Welcome to our presentation on the Test to Stay protocol. This short video offers information on the Test to Stay protocol implemented by schools participating in the Oregon Health Authority's diagnostic testing program. Test to Stay is a form of modified quarantine for individuals who are determined to be a close contact to a COVID-19 positive case in an indoor K-12 setting. Test to Stay allows asymptomatic individuals to continue to safely attend school while observing quarantine for non-school activities. This means that unvaccinated students and staff can continue attending school during their quarantine period if they remain symptom-free during the 14 days post-exposure and they test negative by antigen test when exposure becomes known, and again, 5 to 7 days post-exposure. Participants in Test to Stay must continue with their school-related extracurricular activities during their quarantine period, but must wear a face covering at all times during these extracurricular activities. Test to Stay is for unvaccinated students or staff when they are determined to be a close contact to a COVID-19 positive case in an indoor K-12 setting, in which universal masking is in place, with the exception of actively eating or drinking. This allows students who may be exposed during a meal or snack time to participate in Test to Stay. Individuals must also remain free of any COVID-19 symptoms. Students exposed during unmasked outdoor recess may still participate. However, given the low risk nature of unmasked outdoor research exposures, quarantine is unlikely to be required, so Test to Stay would not be needed. Exposures that take place outside the school setting or during extracurricular activities are not eligible for Test to Stay. Families who do not consent to testing should quarantine at home following their local public health authority's guidance. Individuals who are fully vaccinated and do not have COVID-19 symptoms do not need to quarantine after an exposure. OHA recommends that vaccinated students be tested 5 to 7 days following an exposure. Schools can use their tests to offer vaccinated students and staff a test 5 to 7 days following an exposure, but may also choose not to. Unvaccinated students or staff are tested at school twice in 7 days. The first test occurs as soon as the exposure has been identified, and the second test occurs on days 5, 6, or 7 following the exposure. If they test negative and do not have symptoms of COVID-19, students or staff may continue to attend school in person and may continue with school-related extracurricular activities during their quarantine period, but must wear a face covering at all times during these extracurricular activities. If they test positive, students or staff must isolate at home as directed by their local public health authority and may return to in-person learning after they are done with their isolation period. All close contacts, even those who are vaccinated, should watch for symptoms of COVID-19 for 14 days after an exposure. If at any time during this 14 days, a person develops symptoms of COVID-19, regardless of their vaccination status, they should isolate and be tested. If you would like your student to participate, connect with your local school to see if they participate in the Oregon Health Authority diagnostic testing program. The Test to Stay protocol is open to all K-12 Oregon schools. You must also submit a testing consent form to your school to allow your student to participate in testing. Your school can provide you with the form. Thank you for taking the time to learn more about the Test to Stay protocol. If you have questions around the Test to Stay protocol or any other COVID-19 questions, please feel free to contact us at the ODE COVID-19 inbox at odecovid19@ode.state.or.us.